Good afternoon. My name is Dr. Miriam Clovacista. I'm a GYN oncologist in the Department of Obstetrics and Gynecology at the Hackensack Meridian Health Mountainside Medical Center. I'm here to discuss or review ovarian cancer, as September is Ovarian Cancer Awareness Month. Ovarian cancer can arise from three parts of the ovary: the epithelium, which is the surface of the ovary, the germ cells, or the stroma. The epithelial ovarian cancer is the most common type of ovarian cancer. And so the lifetime risk of ovarian cancer in the general population is about 1.4%, which means about 1 in 71 women will ultimately develop ovarian cancer in their lifetime. Some risk factors for ovarian cancer include family history. The more family members you have that have ovarian cancer, the higher the risk that you may develop ovarian cancer. Also, early age of menstruation, late menopause, not having any children, those increase your risk of having ovarian cancer. Also, a genetic predisposition. There are certain genes that do increase your risk of ovarian cancer. If you have no affected relatives of ovarian cancer, your risk of ovarian cancer is that of the general population, which is about 1.7%. If you have one first-degree relative that has ovarian cancer, and a first-degree relative includes your mother or your sister, your risk of developing ovarian cancer is 5%. If you have two or more affected first-degree relatives in your family, then your risk of developing ovarian cancer is 7%. Studies have shown that there are some vague symptoms that patients have had multiple episodes per month for at least a year. And some of these symptoms include abdominal bloating, pelvic pain, early satiety, which means just getting full after eating a regular meal. Those tend to be the symptoms, and they can come and go, but they are persistent. So any of these symptoms that are persistent for more than 2 to 3 months, you should seek medical attention. So patients ask me, well, what can I do to try to prevent or decrease my risk of ovarian cancer? And some things that have been shown to decrease your risk of ovarian cancer include being on oral contraceptive pills. The longer you are on birth control pills, the lower your risk of ovarian cancer. They find a benefit after 5 years, after 10 years, after 20 years, but the benefit increases after 5 years. Another thing is what we call an opportunistic salpingectomy. What that means is if you were to have a GYN surgery, so for example, if you're going to have a hysterectomy or if you decide you're going to tie your tubes, it is better to remove your fallopian tubes at that time of the procedure instead of just tying your tubes, and has shown to decrease your risk of ovarian cancer. For patients who do have a genetic predisposition to ovarian cancer, or you have a gene that increases your risk for ovarian cancer, removing the ovaries and fallopian tubes have been shown to decrease your risk of ovarian cancer. So if you have any questions or concerns, or if you feel like you may have some of these symptoms and you're not sure if you're at risk for ovarian cancer, please visit our website at www.mountainsidehospital.com, and we can refer you to either our gynecologist or oncologist if you're at high risk, and we can discuss further. Have a great day.